Further amendments? Mr. Rogers.
Thank you, Mr. Chairman. This is something I hope we can agree to as well. In the last rendition of HIT, we agreed with the chairman. I withdrew this amendment, because we agreed that there was some common ground on this and we could work it out. Unfortunately, we didn't have the opportunity to do that. The bill never moved forward. But what this does, it's about the accounting of disclosures. And under HIPAA, individuals are currently entitled to an accounting of certain non-routine disclosures of their protected health information. That's a good thing. Providers are required to compile a list of these disclosures at the patient's request, also a good thing. However, there is an important exception for treatment, payment, and healthcare operations function. Unfortunately, this bill, I hope inadvertently, removes that exception. Providers conduct millions of legitimate, justifiable disclosures each year for the purposes of treatment and payment. You have to do it. I mean, there's no other way the system works. And if you can imagine, as an example, if a doctor is looking for a second opinion, he sends an email, according to this new law, he'd have to find a way, or she would have to find a way, to account for that email for 3 years. I mean, it is very onerous, and it's really not protecting the patient to the degree I think we all agree should happen, but it does add this an onerous regime on these providers to do something that I think we can all agree should protect them, maybe not in this way. The information, by the way, is rarely, if ever, requested. I'll give you an example. One of the largest pharmacies benefit managers, a PBM, covering 60 million patients, has only received 6 of these very specific requests over 10 years. 60 million patients, 6 requests over 10 years, and we're going to create this whole regime of them having to require every disclosure when somebody opts out and says, this is how much money you owe, they have to now account for that as a disclosure. I really think that if we go where we're trying to protect the patient, this doesn't help. Actually, it's going to add lots of costs, lots of confusion, and it's quite clear it does not benefit the patient given the number of requests they've received. So, Mr. Chairman, as I said, the last chairman said that we would work this out. I would, at your desires here, I will withdraw. If you want to work this out, I'd be happy to do that. I think we'd find lots of common ground on this amendment. Or you could accept it. That would be good, too.
If the gentleman will yield to me, I think the amendment makes it more complex, and I don't quite see a way to work it out.
Oh.
I'm sorry to tell you that. So we're going to have to oppose the amendment. I want to recognize Mr. Pallone.
Mr. Chairman, I think that actually the gentleman's amendment would make it more difficult to separate out when a disclosure is made for treatment purposes versus payment purposes versus healthcare operations. Basically, it's going to require more work for providers to separate out the disclosure for these different purposes. Obviously, transparency is very important if you want to ensure the privacy and security of the individual's health information. And all this underlying bill does is require that the entities maintain an audit trail of when a patient's information was disclosed, and that could be for treatment, payment, or healthcare operations. I don't see I think it would just be a lot more difficult and allow for less transparency if you basically said that we're not going to do this for treatment or payment purposes and only for the healthcare operations category. So I don't see, again, I agree with the chairman that there's really no way to work it out because we want to provide this transparency for all these purposes.
Would the gentleman yield? Just the time you have left. What you're talking about, though, doesn't exist today. They have to do the audit trail on other than treatment and payment disclosures. But now what you're telling them to do is every time you provide that treatment and payment, you have to cut an audit trail for every one of those so-called disclosures. That happens millions of times every single day in the administration of our healthcare system. And that's why pharmacists disagree with you, providers disagree with you, insurers disagree with you, that they look at this and say, geez, this is a huge, huge ask, very expensive, for no gain to the patient. So I would argue it really keeps in place what is a good audit trail today, and they should have to disclose or audit those disclosures, except when it comes from the ordinary routine business of providing health care in America.
Gentlemen,
You've created a whole new standard. It's not my time
Yield
to yield.
to the chairman.
Well, I just want to make the point that the bill has been modified since it went through the committee when this was first offered, and entities maintain an audit trail of a patient's information through an electronic health record, including for treatment, payment, or health care operations such as quality assessment and medical review. And has changed. The bill only applies to disclosures from the electronic health record and only requires data that can be automated, be collected about those disclosures. So I would join you in opposition.
Again, now they'll have to track emails, Mr. Chairman. I hope we know what we're doing to these folks. It's going to be fairly onerous. But with that, I'd request a roll call vote.
The amendment is before us. All those in favor of the amendment say aye. Aye. Opposed, no. No. The amendment's not agreed to.
How about showing hands?
Well, the gentleman requested a roll call vote. I thought we had some understanding as to when we're going to have roll call votes and when we're not. All those who want to...
In the spirit of cooperation, Mr. Chairman, I'll withdraw that. However, we were also to understand that you would work with us on some of these amendments.
Well, I'm always
certainly
available.
very willing and eager to do that.
I'm always available to work with you.
Well, I will withdraw that, Mr. Chairman, but I think this is something we absolutely have to come to a conclusion in. And everybody in the community disagrees with your assessment of what it will ask them to do versus the benefit of the patient. So I'll withdraw my request for a roll call vote under the condition that you'll work with us, Mr. Chairman.
I certainly will promise to work with you further on it.